Madam Speaker, I rise in strong support of H.R. 1425. This legislation expanding and enhancing the Affordable Care Act and lowering health care costs for all Americans. In the past 6 months, over 120,000 Americans have died due to COVID-19. Millions have lost their jobs, and in many cases, their health insurance. That's why it's so critical that we strengthen and build upon the foundation of the Affordable Care Act, which is exactly what this bill does. This legislation reduces the price of expensive pharmaceuticals, including insulin, saving taxpayers billions of dollars while driving down drug costs for all Americans. And the bill uses those savings to lower insurance premiums and expand tax credits, helping more Americans afford the coverage that they need. This bill bolsters state Medicaid programs, funds COVID-19 vaccine research, and cuts the number of uninsured Americans by nearly 4 million. The President and my Republican colleagues are actively trying to gut protections for pre-existing conditions and take health care away from millions of Americans. By contrast, this legislation reduces health care costs for millions of Americans at this critical time. It's vital that we give our constituents the help they need. And I heard so many of my friends on the other side talk about how they want to protect people who have pre-existing conditions, every one of which is in support of the lawsuit to repeal the Affordable Care Act, the very bill, the very law that protects people who have pre-existing conditions. You cannot be for protecting pre-existing conditions and for repealing the law that provides that protection. I urge my colleagues to vote yes on this bill, and I yield back the balance of my time.